Hi, I'm Kimberly Velez, a licensed mental health counselor. So today we're going to talk about the 6 things that you can do to help your loved one in active addiction. The first thing you can do to help your loved one in active addiction is don't enable. Families often confuse enabling with supporting. Enabling is when you do something for someone who's capable of doing it for themselves. And supporting is when you are helping someone who's helping themselves. So when someone's in active addiction and you're paying their bills because they're mismanaging their money, because they're spending their money on drugs or alcohol, or they're not going to work, then you are enabling. You are fueling the addictive cycle, and that's what we don't want to happen. So the best way to help your loved one is make sure you are not enabling. The second way you can help your loved one in active addiction is do not rescue them. So families like to jump in and mitigate the consequences for their loved one's actions. And the reason why that is not a good thing to do when you're dealing with someone in active addiction is that it keeps the addict in the distorted state that this is not a big deal, that my addiction isn't as bad as everyone maybe is making it out to be. Look, I barely even have consequences. It's not making me uncomfortable enough to want to stop using. So it's critical that when a family member is aware that their loved one, whether it's they break the law, they are mistreating them, doing something that isn't, appropriate, that the family doesn't jump in and rescue. The family should not be paying parking tickets, hiring lawyer after lawyer, allowing behaviors to occur because the excuse is that they're in addiction. None of these support recovery efforts, and all it does is fuel the addictive cycle. The third thing families can do to help their loved one in active addiction is stop making excuses. Families sometimes think, oh, this is a stage, they'll get over it, but this stage has been going on for several months, a year, possibly more than that. Families sometimes, make the excuse that this is the drugs acting this way, this isn't my child, especially when the addict is being disrespectful, stealing from them, lying, manipulating, or being abusive. And it's time to stop making excuses because, again, it sends the message to your loved one that things aren't really that bad, that this isn't a big deal, that my behavior is okay because everyone is tolerating it and accepting it. In active addiction, they are distorted. All they want to do is get high. They will manipulate anyone who gets in their way of them getting high. So families really don't want, again, to make it easy and a comfortable way for them to continue to use. We want to start disrupting their comfort in getting high. We want to make it inconvenient for them. We don't want to make this an easy situation for them. The fourth thing you can do to help your loved one in active addiction is get on the same page as a family, present as a united front. And what that means is that your loved one has privileged information of how to manipulate each and every family member. They know what emotional hooks to use, they know what buttons to press, and they will do that over and over again to get their way. So families need to regroup, come together, talk about what's happening in the home or with each other in regards to their loved one in active addiction, and set up some boundaries that support recovery efforts and discuss consequences that they're willing to implement if these behaviors occur with your loved one in active addiction. When the addict has a hard time splitting the family or putting cracks in the recovery foundation the family is setting up, then it is less likely to feed the addictive cycle. They start running out of options and their drug use becomes more uncomfortable. Again, not as easy as it has been in the past. So it's really important that families stick together, discuss things together, and do not let their loved one manipulate or split them any further. The fifth thing that families can do to help their loved one in active addiction is believe what they do, not what they say. Addicts will make false promises and get families to hang on their words of hope, and families struggle with that. Families want desperately for their loved one to stop using. They want to believe that their loved one is being sincere when they make these kinds of promises. And it's not up for debate if they're being sincere or not in the moment. It's what is the follow through, what's happening after they say these things that matters. So families, please look at their actions, not their words. If their actions do not match what their words are saying, then there's your answer. And again, you can't go back to hanging on to, well, they promised this, they said they were going to do this different, when they're not doing any of that. The sixth thing you can do to help your loved one in active addiction is take care of you. Offer yourself the same gift of help and support as you are to your loved one, even if your loved one refuses it. You all need to reconnect with each other as a family, friends. Get back into doing things that feel good for you, hobbies, activities, spending time together, laughing again. It's so vital to breathe life back into the family when everyone's world has been turned upside down with crisis after crisis dealing with drug addiction. So please, please, please do these 6 things to help your loved one in active addiction. Unfortunately, none of this is a guarantee that your loved one will stop using, but what it does is it gets the family to regain their footing and rebalance and set things up for the possibility of a better outcome.